Assalamu alaikum. I'm Dr. Mariam Atiq. Today we are going to talk about the importance of vitamin B12 in the body and what can be the warning signs of its deficiency. Vitamin B12 is a water-soluble vitamin and it is very essential for metabolism, for the formation of new cells, the healthy red blood cells, and the formation of nerve cells, especially the myelin sheaths of the axons. So how will it affect the body? Normally, very little quantity is required, around 2.4 to 2.8 micrograms per day, and it can be attained from the diet. Which foods are there that can help you provide this vitamin B12? They are mostly the meats like beef liver, like normal beef meats. Then they can be fatty fish, sardines, trout, salmon, tuna. They are very healthy sources of vitamin B12. Then eggs, they are a very good source. Two big eggs, that will be around 100 grams of eggs, can provide you with 46% daily dose of vitamin B12. Then dairy products such as milk and the fermented dairy products like cheese, like yogurt, they are also very rich sources. Then it can be present in the nutritional yeast. Then some fruits are also good in vitamin B12 sources such as bananas. Sometimes what happens is that the dietary intake of vitamin B12 is good enough, but still there is a deficiency. Why? Because this vitamin B12 needs an intrinsic factor for it to be absorbed by the blood and the body to provide its helpful functions. Now this intrinsic factor, it is a protein which is made in the stomach. So causes that cause a decrease in this intrinsic factor are going to affect the absorption of vitamin B12 from the blood. So what are the things that can cause this decrease? Anything that can affect the acidity of the stomach. This intrinsic factor is formed when the stomach acidity is normal. So conditions such as in old age, there is no problem, but there is decreased production of the acid, and as a result the vitamin B12 absorption will be less. Then inflammation of the stomach lining, such as in gastritis, in the atopic myeloblastic gastritis, the lining of the abdomen becomes thin, the acid production is less, and once again less vitamin B12 can be absorbed. Then diseases such as the irritable bowel disease, in which the celiac disease is there, there's the Spruce disease, because vitamin B12 is absorbed in the distal part of the small intestine, the distal part of ileum. So these diseases that affect those parts can again hamper the absorption of vitamin B12. Then diseases in which there is an overgrowth of bacteria in the intestine, such as in Crohn's disease. In cases of HIV, again the vitamin B12 absorption will be affected. Then the gastric bypass surgeries. These days there is a fashion trend that to lose weight, people tend to have the gastric bypass surgeries, also called the weight loss surgery. It reduces that part from where the B12 can be absorbed. Therefore, those people need to take vitamin B12 as supplements, as injections throughout life. Then certain medicines, such as the medicines which are taken in diabetes, then those medicines that are used for acidity, they also decrease the absorption because they coat the stomach lining, decrease the acid in the stomach, and therefore once again vitamin B12 is absorbed less. So all these conditions, or yes, a very important one, once again, people are very much into dieting, fad dietings, all vegetarian diets. Now meats and poultry are the main source for these vitamins, vitamin B12. Therefore those on a regular vegan diet for very long periods, for years, also become deficient in vitamin B12. So what can you do? What can you do about it? What are the warning signs? You have to know the warning signs, then only you can get the treatment. So the warning signs will be generalized weakness, overall tiredness, inability to do the work, lack of concentration. Then healthy RBCs are not there. They carry the oxygen, and that oxygen helps to do all the body functions. So when there are less RBCs, there is the state of anemia. And with anemia, once again, comes lethargy, lack of energy. Then there can be shortness of breath. There can be rapid breathing and palpitation, because the heart is trying to compensate for the less oxygen available. It is going into an overdrive. Then there can be the involvement of the nerves. We said that it helps in making the nerve cells. It forms the DNA for those nerve cells, and is especially important in making the myelin sheaths of the neural cells. To understand this, we see that the normal electricity wires that supply electricity to us, they are coated with a rubber coating, so that these electric wires, they do not touch each other and get short circuited. In the same way, the neurons which carry the signals to and fro from the brain, they have got tentacles, they have got those axons, which are called axons, and the further smaller ones are the dendrites. So these axons, like these wires, are covered up with a thick fatty sheet, which is known as the myelin sheath. In the absence of vitamin B12 or in the deficiency, these myelin sheaths are not produced, or they are defective, which can cause irreparable damage to the nervous system. How will it manifest? It will manifest in the form of a buzzing sensation, a tingling in the peripheral nerves. These nerves are supplying the hands and the feet, the limbs. So there will be a feeling of buzzing, sensation, tingling in these nerves. There can be numbness in these nerves. Then due to lack of this energy as well as the nervous effect, sometimes a person is unable to walk also due to the weakness and the neural involvement. Then if they affect the optic nerve, then the eye cannot function properly. There is first of all difficulty in recognizing the different colors. Then there can be retinal bleeds, and then there can be painless loss of vision. Sometimes it can even cause blindness. Then there are other neurotransmitters which need vitamin B12, and its absence, these transmitters are less, which can produce a feeling of anxiety, depression, psychosis. A person is in unreal world. They cannot understand properly. They are confused. There is delirium. So there can be memory loss. All these effects are just because of a lack of vitamin B12. Oh yes, and we forgot about an important symptom. The tongue. The very state of the tongue can also tell us that we are deficient in vitamin B12. The tongue becomes red, beefy, sore, and there can be mouth ulcers. So what do you have to do? You have to understand these effects, and once you understand them, you have to consult a doctor, and the doctor is going to get your levels checked, and then you are going to be told whether you need oral supplements of vitamin B12 or you need the injectable form. Methicobal is a very important and very common oral supplement. It is available in the 500 micrograms dose, and according to your levels, the doctor may advise you once daily or thrice a day for a certain period of time, and then the levels have to be monitored. Sometimes when the deficiency is more severe, you may be advised to take injections of vitamin B12, which are normally given on alternate days for at least 2 months. So please recognize your symptoms and try to have enough diet. And if you are suffering from the other problems that can affect its absorption, please go to a doctor, get them corrected, and stay healthy and have a very nice life. Thank you, and inshallah we'll come back with another topic.